Hello, I'm Robin Whatley. I am a physician practices obstetrics and gynecology as a hospitalist in Illinois. And I wanted to share a story with you about a life save that happened at my hospital. So I was on shift at the hospital. There was a patient who came into the emergency room. She was 25 years old. It was her first baby. She had her prenatal care at another institution and happened to be visiting in our area for the time. And she presented with a witnessed seizure at home. Now, this particular patient did not have any particular medical problems. From what we knew at the time, no significant risks to her pregnancy at all, and all had been going well. And right before she came into the emergency room, she started to have a headache, said that she wasn't feeling well, and then she seized, according to her significant other. So she was brought into the emergency room. And since I was the hospitalist on that particular day, I was called down immediately to see the patient. So I was able to attend to her within seconds of her arriving to the emergency department. Of course, we did a complete evaluation. We at the time we assumed that she was having a seizure because of eclampsia, which is a condition of pregnancy where women will have seizures due to elevated blood pressure and some other things going on with the pregnancy. But so we assumed that that's what she had. We evaluated her. I treated her as such. We started a medication called magnesium sulfate, which was administered right there in the emergency room. I was able to stabilize the patient, do a complete evaluation, and ultimately the patient was sent for a cesarean section, which I performed. And the baby was great. The baby came out healthy, screaming and crying. Mom was great. And after her delivery, she did well. She ended up going home on the fourth day after her surgery, and mom and baby were doing well. And I love to share this story because as obstetricians, we have all been trained to react and to treat these disorders. But being able to be there in the hospital when it happened and attend to the patient immediately is something that you really can't put a price on. And, I was able to, for that patient, of course, she came in, her family was very nervous, very scared. I was able to, provide excellent and immediate care to that patient. And how wonderful the story turned out, of course, but how comfortable the staff in the emergency room and the other physicians, how reassuring is it for them to have an board certified trained provider in the hospital available to attend to these types of patients. And so, I really think that the the value of having someone in the hospital to attend to this is tantamount. And I tell my story from the perspective of a hospitalist, but prior to becoming a hospitalist, I was a private practitioner with my own private practice for over 10 years in this same hospital. And so I would have loved to have a hospitalist in house at that time when I was practicing because I'm able to provide the service to the hospital and to the provider, but as well provide excellent care to that patient that was coming in. So there is nothing more fulfilling than having to be able to perform in this role. So that's why I wanted to share my story.